Hello, my dear friends. Welcome to Aspire32, and this is your friend, Dr. Suresh Shenvi. Today, I have a very esteemed guest on this podcast on Aspire32 to talk on how to get admission into DDS program in United States. And I'm very happy to introduce you to Dr. Vinita. She is alumni of KLE Institute of Dental Sciences in India, and then she finished her MPH in North Texas, USA. And then she recently got into UNC dental school from from United States of America, and she is here today to share her experience in this journey, which is often very confusing and tiring. But it is Dr. Vinita who can really guide all of us with some authentic information, and she will also tell us the challenges what she has faced during her journey through this DDS, and we generally call it as Advanced Standing Program for International Students. Thank you, Dr. Vinita, for accepting our invite to come on this podcast on Aspire 32. It's amazing to have you on this platform.
Thank you so much, sir. First of all, thank you for the opportunity that you gave some heavy introduction, and I don't consider myself so much, but thank you. So you can start with your questions, and I'm happy to answer any questions that your viewers have.
The introduction was not actually very heavy. I have gone through her CV, and she has achieved a lot. But the one thing which you're focusing today, Dr. Vinita, is how was the journey overall?
It was a roller coaster ride. I will not lie about it. So I knew that I wanted to do DDS right from my second year or third year of BDS. So we were fortunate enough to have one of the alumni come to our dental school and give us introduction about what are the pathways that you can come to the US and pursue dentistry. So I chose to pursue Masters in Public Health. So because I graduated in 2015, I came here in 2016. I did my Masters in Public Health with my major in epidemiology, and that was a 2.5 years course. After which, in this time, I kept giving my NBDE steps. Within a year, I completed part 1, part 2, took my TOEFL, and just to know how the cycle works after like giving both my exams, I just put a application just to see how the CAPIT cycle works and what is the groundwork that you have to do. I just applied to 2 or 3 schools. I never got called with them though, because I had completed working on my exams, but I didn't have a good resume. So the next few years, I tried to worked on building up my resume, with just not, completing exams as such. So I graduated from my MPH program in 2018. And that year I had about 2 interviews, but unfortunately I did not get in. But I had to maintain my status here as a F1 student. So I got a job in Texas State Health Department as an epidemiologist. So with the same title, I worked for about 2 years, and at the end of which I got into DDS finally. So it was an arduous journey.
It's a long journey, as everyone has said. But of course,
yes,
there is one question which often get from all the students who are international students who plan to get into this DDS program, that is also called as Advanced Standing Program, because for international students, it is for 2 years. But one thing which you have to enlighten us, and the question often repeats very often, that can you get into DDS program with just BDS from Indian BDS degree?
I cannot speak in common. I cannot speak generalized to all schools, but I would say there are schools which which actually encourage early, fresh graduates. Like there are a couple of schools who want fresh graduates to be in their program because it is easier for schools to make them unlearn and relearn certain concepts because they are fresh. Because as you know that they don't have much experience in a clinical field, it's easier for them to learn newer concepts, or sometimes, as I said, unlearn and relearn new concepts. But again, I won't say it is easy, because if these students are getting selected into these schools, they would have done something very considerably higher compared to their classmates in their home country, which is India. So maybe they have some good research work, or they have participated rigorously in some clinical programs, or have outdone themselves in some way than their regular batchmates would do. Like maybe go for an international conference, maybe attend some advanced courses. Like I knew that our school had offered an implantology course, which only few people enrolled and the others didn't. So if a person like that would have applied right after graduation versus me who applied without anything, there were higher chances of that person being called than than me being called. I hope that answers your question.
So this means that if someone has an MDS degree in India, that should really help in getting the admission. Do you think there is a higher chance of getting into DDS?
I will try to correct that. I will, again, as I'm saying, getting an admission is totally dependent upon a student's performance in the interview, technical round, and bench. So I can say that having BDS and MDS will higher their chances in getting invitations from the schools to interview. But it doesn't always work that a person who has MDS will get selected over a person who has BDS. It's totally dependent upon the way they perform at the interview, but definitely it'll higher their chances of getting called for interviews.
Okay. So if I ask you maybe what are the 5 important things one should have in their CV before they plan to do and apply for the DDS program, what do you think will be those 5 important things one should possess?
First thing, initially, when I started applying, people would apply with part one and part two. Nowadays, having part one, part two is a prerequisite. Like you need at least any international dentist needs to make sure that they have both their parts cleared before they apply. Next thing is having a good TOEFL score. I know many of them have about 100 or 103 and they apply. Some have 99 too. But if you want to be in the competitive pool where you know you're as a sure shot that you will be invited, anything above 105 or 110 is encouraged because that'll make sure that your profile is ranked high. The third thing I would say is shadow dentists. Um, Shadowing just doesn't mean you go in, you just stand there, ask questions, because the way we have practiced dentistry in India differs from the way we see dentists practice here. They have newer technologies and many things that you wouldn't know. Like I had never seen uh, what did you like a gun that you use to load provisionals. I think this is also a reason because we never have that awareness when we are in India. Like probably dentists or PGs around in the clinics use it, but a student would never bother and go and find out and fidget and ask, what is this? Why do we use it? Because probably at that age, we are too naive for it. The fourth thing I would say is try to volunteer, gain some volunteer experience, any sort of community service. You cannot fool schools by saying you've done 1,000 or 9,000 hours of volunteering because you have a life. They know that volunteering is only done to uh, give give some part of yourself to the community so that you're doing something meaningful. And schools will understand if you're able to do that for like 4 or 5 hours a week, which is where you have to be um, rational in mentioning that in your application. These four are like the prerequisites. The fifth point I would say is if you have a chance, maybe get some research experience or try to try to attend some dental conferences or do some continuing education courses in dentistry. There are some free ones available on the internet like Colgate, but I would say try to do some hands-on continuing education courses, um, at least a couple of them, and the rest can be um, certificate courses where the schools understand that the student is putting continued efforts in learning newer technologies or newer concepts about dentistry.
So when you're saying that you can do some research, you can do the observership, do you think this is what people have told me, that it is the things what you do in United States are more important than what you have done in your country? Is that true?
It is true to a certain extent because you are in the end applying to a school in the United States. So it will also matter to them what you have done in their country. If you've lived in this country. If somebody is applying from an international country, like if you're staying in India and applying to the US, then it makes sense. But if you've been staying in the US and if you've mentioned that in the application that you reside in some state in the US and it's been 2-3 years, it'll always give them a question mark. Then if you've been staying here for so long, what have you done here to gain experience? So I think to a certain level, it is important. I would just suggest that wherever you are, try to gain some experience. There are always a lot of opportunities, and everybody here in the United States is open to emails. They are um, uh, very good at responding to emails. So just go on to Google, type some, look for some opportunities near wherever you're staying, and just email the concerned person, and you might get some reply. And yeah, that's what I think. Like, um, I don't know if it is must or not, but definitely reaching out is important. And yeah, having it is important if you've been living in the country for a couple of years.
That's really nice information, Dr. Vinita, and thank you for sharing it. And I'm sure that not everybody will give such a detailed information. Generally, it is very difficult to know what exactly one should look for when you plan for this application process, because the process is very lengthy. And as you said, initially people used to apply with part one, part two, and then there is ADAT exam, which is there, which is generally asked for the higher degrees. But the usual, and now and I think that is also converted to the INBD. The NBD is now converted to INBD, and the process is becoming more challenging. But as personally, I do believe that someone who has really worked hard should be able to clear that exam also. But if I ask you one important question, that which is that one important point, or which is that one important achievement from India which contributed majorly in your success in United States?
I think I was. I would like to consider that I was good at academics. I tried to work as hard as I could when I was in KLE, be it theoretically or be it practically. I mean, in regards to practical, I didn't take many leaves even while I was in internship. Um, I I just tried to make as much as views while I was in internship. I think that really helped achieve a good profile overall in regards to India. I've attended a lot of camps, I must say, which helped me gain a lot of rural experience on it. I mean, treatment experience over a large scale. I took personal interest in treating different sorts of patients. And when I didn't know how to work on a case, I always made sure I took the right guidance. I spoke to professor early ahead saying I have a patient schedule. The reason I'm saying is this because when you've done a lot of things, you can mention that on your application. And also, like in an interview, an interviewer asked me about how I went about a certain procedure, and because I had done it by myself, I was confident enough in speaking about it. So I think I would consider like my academics and my clinical experience as my stronger note.
Thank you, Dr. Vinita. And of course, whatever you said is really, really true. And I'm sure that the viewers will really appreciate it. I just wanted to know what is the current fees for the DDS program?
So the fees varies anything between $200,000 to about $500,000. depending upon where you get into the school. Like if you get somewhere in East Coast or West Coast, like New York area or California area, the schools, either the school fee is pretty high or the living expenses are very, very high. Versus somewhere you get middle, but this is the range of $200,000 to $500,000. This might or might not include living expenses depending on the school again.
And how do the people uh, find the finance? I'm sure when somebody looks for DDS from some international country, they would plan for some loan from the Bank of United States, from the United States.
Yes, some people have the capacity to pay their own fees. Like some people have the money to afford at least 1 year's fees, or some people actually afford 2 years fees. The rest of us, like most of the students, take a loan from the United States, and in order to get that, you would need a co-signer here, who either has to be a U.S. citizen or a person holding a green card, because that person's credit check would they would the banks would run the credit check, and you would get a loan. Unless, like, another question I think must pop up in most students' brain is, how difficult is it to get a loan? If you have a co-signer, and if you have a US, like if you have a co-signer and they have a decent credit score, you will get a loan. Getting the loan is not the most difficult process. Having a co-signer is the most um, daunting process, honestly, for anyone, because it's a huge amount, right? And anybody staying here would also like think twice, because co-signer is like a guarantor, right? If you don't have, if you cannot practice in the future, they would be held responsible. So it's usually close family members or somebody like that. But again, they also will have kids, and they would also want to send their kids to school. So yeah, this has to be something everybody needs to think about. Also, you don't have to get the same person to sign your loan every time. So every semester when you apply for a loan, you can have different people sign for you, so that one person would not have to take the entire financial responsibility.
I think that's really nicely put, because we think so much about how much money it will require. Maybe the best advice what you said is, first think about who is going to co-sign your loan. But coming to the visa questions also, because some questions do ask, the students
Mhm.
do ask this question. I'm sure the NBDE exam can be given on the B1 B2 visa, which is a visitor's
Right,
visa, right?
right.
And for if you plan for any degree, it has to be given on a student visa, which is the F1.
Right. It can either be, if people can choose to come on student visa, or there are people who get married to either someone who's working here in the United States, so they will be dependents, which is H4 visa. Yeah, these are the most. Some people come on J1 and J2 visas, which is for postdoctoral and things like that. But I'm not very sure if you can study on that visa. If anything, if you're again coming back to studying, you can either study on an F1 visa, or a dependent visa, which is H4, or you have to be a green card or a citizen.
Yeah, I know that the J1, there are people who come with J1, but there are specific clause associated with it. Some visas do say that you have to go back to your own country after you finish your studying. So, the dear viewers, although Dr. Vinita is giving you the information, but I would also like you all to do your own research, because the things keep on changing. It is not that easy, because every year there will be some visa restrictions, and I'm sure with the COVID situation, the admission and everything is again, there is a lot of dilemma. Did the COVID, was there any delay because of this situation?
This year was chaotic because every year, you know how interviews happen, and the timeline for interviews and how they are scheduled. Usually, students tend to have an idea. This year, it was all chaos, but despite that, universities worked diligently in putting forward a new pattern so that students could interview, and they did conduct interviews, but we had a lot of uncertainty as to what is going to happen, because usually there's a bench test and a technical round, but this year they had to devise a newer method for testing. So the invites or the interviews were sent out pretty late, and some schools did send out pretty early though. But trying to figure out Zoom, and the most difficult part was the technical issues, which was either Zoom or other platforms of video, like video interaction, basically. Right.
And you mentioned something about bench test. Is it something very similar to the practical exam what we have in India?
Well, bench test can range from a simple class to cutting to elaborate process of then having you um, cut a class two or cut a crown, especially like an FPD, make a provisional on it. Some schools have you do surveying for an RPD, or some schools have you actually cut a tooth and restore it again with composite or amalgam. So it varies depending upon the school that you apply to, and each school has their own requirements. But in general, they are pretty strict about their bench test, because that's how they kind of classify the higher scoring students into, like, the most competitive ones and the lower scoring. So the criteria is usually like acceptable, not acceptable, or either, acceptable, sub-acceptable, or fail, not clinically acceptable, something like that. So yeah, there's a wide variety of what can be asked in different bench exams.
And how did you prepare for it? You did the MPH program for 2.5 years. How did you again
Right.
brush up your skills for the bench test?
So if there are a lot of YouTube videos, you can have a home setup. So I used to watch a lot of YouTube videos. I had a home setup with a air compressor, a turbine unit. I had my different typodons. So you get different typodons. There's skill core typodon, there's Columbia typodon, there's accidental typodon. These are different typodons asked by different schools. So I had all three just to have the feel how each tooth cuts, because the contacts are different on different teeth. And I had an erotor at home, just like most of the clinical setup, and this is how we practice. But then I realized after a point that after failing at the first cycle, I realized my hand skills were not up to the mark, at least compared to my fellow competitors. So initially, I came to India a couple of years back, and I took the ODA course, which is in Chandigarh. I would really recommend that course because Dr. Rajesh Joshi is doing a great job. He's really good at what he teaches. But then I came back, and then COVID happened, and I just didn't feel confident enough to appear for a bench, because I felt this was my last try and I didn't want to hold back anything, and I wanted to give my best. So then I took up this course with Dr. Stevenson's here, and he's here in California. It was a
Does he
1 week
have a
course.
YouTube channel?
Oh yes, he does,
Oh,
and
that's
his
one of
videos are
the
great.
amazing channel. Even I
Yeah, his
watched.
videos are great. Yeah, and I went to him. He kind of changed my work so I would give the credit to my handwork to both Dr. Rajesh Joshi and Dr. Stevenson.
Okay.
And ever since I came back, and then I used to come home, I used to religiously practice at least 2 crowns and 2 class 2s every day. And that slowly kind of improved my handwork. And I think I just felt ready to take an exam at the end of 3 years.
But that's I can feel the amount of challenges what you have faced
Yes,
throughout this journey, and I truly believe on one fact that many good things happen at the moment when you want to give up.
that's
God
true.
test you,
That's true.
God test you really till the end, and you're almost
Yes.
like, no, I'm not going to do it now, I'm done.
Yes.
That is when
Yes.
sometimes maybe another one extra effort, a last
That's true.
effort, with some confidence may end up you getting the thing which you always worked for so many years. So God has
That's true.
planned everything, and I'm sure Dr. Vinita, that whatever information you have shared today, is
Mhm.
really, from your heart, and I can feel that how much struggle you have done through this journey, and we are proud as a teacher to listen to this journey, and I'm sure the viewers also will be motivated. But one last question which I want, and you can give us some brief idea about it, that I have seen that from beginning of this podcast you have been stressing on how the result is based on, the selection is based on your performance in the interview. What exactly a teacher expects from you during this interview?
I learned this the hard way. I had to go through a lot of rejections to understand what they're looking for a candidate in an interview. So there are different. So after the bench, usually there is a technical round where a professor or an admin staff of the school interacts with the student to know their personality. So it's not as easy as you finish an exam and if you score well, you get in. So they want to see the candidate as a whole, like how that candidate would fit into their school and coexist with the other students there. So they're basically looking at how good are you at teamwork. Um, how willing are you to learn newer concepts, or if you have already practiced in India for a long time, how willing are you to unlearn those concepts and learn newer techniques, like how you would learn new things to deliver the best treatment to your patient, and test you on some ethical questions, some personal questions, how you would react in such situations. And when they're asking you all these questions, your body language, your diction, your delivery, how confident you are, they're going to look for all these things. So that also needs, at least for myself, I needed some training because I never had an opportunity like this in India, and I never had to go through this process. So I felt that I was lacking in these aspects. So I did take coaching from these people called, they own a channel. Their name is Nora and Karthik, and they have this channel called Capit Simplified, and they offer these services where they take mock interviews. And this kind of helped me in reforming my answers and the way I deliver my answers. So yeah, again, thanks to them.
At the end, I would like to really thank you, Dr. Vinita, that you have been really kind in sharing this information. If you have one message for the viewers who are planning or in the process of getting into this DDS, what would be that concluding remark?
First of all, again, thank you for the opportunity. And the message that I would probably give my fellow dentist friends is work hard, but also be smart in whatever work you're doing. Just don't keep on doing work and be upset that it's not taking you anywhere. Be smart in making those right choices. So it is an arduous journey, but it is definitely fruitful. Just keep at it. Don't stop, and you will get there. Yeah, just hang in there and just keep going. Just don't stop.
Thank you so much, Dr. Vinita, for all this wonderful information. I wish you all the best. And as a teacher at KLE Institute of Dental Sciences, we hope to see you once again at our institute, and you can guide the students at our institute too. And thank you once again for coming on this Aspire 32 YouTube channel. Uh, and my dear viewers, we'll see you once again with one more podcast very soon. If you found this video helpful, please click the like button and subscribe to the channel, and do share this video with your friends. Bye for now.